Hello, good afternoon, everyone. Welcome to Transfer Tuesday. This is actually our last Transfer Tuesday session. And I just quickly want to introduce the three of us here at Leeward/Manoa. I want to introduce Amy McKee. She's the UH Mnoa Transfer Specialist with the Ka'i'i program. She's also assigned to Leeward Community College, so she sees a lot of our Leeward transfer students. I want to introduce Jordan Luton. She's our Leeward Community College online counselor. So she sees a lot of our students who are in the accelerated online program, as well as other students who have questions about enrolling at Leeward and transferring. And my name is Laurie Labarrios, and I'm a Leeward CC counselor as well. So thank you for being here. We welcome you. Our session today will include two fantastic speakers. We're so excited to have Dr. Kiana and Dr. Bernadette. So Dr. Kiana she's coming from the PreHealth, Pre-Law Advising Center. So she will be speaking on lots of different things on with students who are interested in going into the health field or law. The speaker she's actually going first is going to be Dr. Bernadette Gonzalez, and she's from the honors program at UH Mānoa. Dr. Bernadette, did you want to go first?
Yeah, no problem. Could I share my screen? I've got a PowerPoint that...
Yeah, you know, we have just a few more announcements and then we'll go ahead and get started.
Perfect.
Is that okay?
Yeah.
Okay, thank you. So I'll introduce Amy from here.
Thank you. All right, thank you so much, everybody, for joining us today. Before we get started with our presentation, I just wanted to share some information about UH Mānoa. So the University of Hawaii at Manoa was founded in 1907 and is considered a land, sea, space, and sun grant institution. We offer over 100 undergraduate bachelor's degrees for you to choose from, as well as many graduate and professional degrees, including law, medicine, business, engineering, social work, education, and no, I might be forgetting one, but we do have many professional degrees for you to choose from. We are also the flagship campus in the University of Hawaii system, an NCAA Division I school, highly ranked Research 1 institution, and we strive towards being a native Hawaiian place of learning. If you're thinking about transferring to UH Mānoa within the next 1 to 2 years, we'd love for you to consider joining the Ka'i'i program. The Ka'i'i program is a partnership between UH Mānoa and the community colleges, and we help students transfer smoothly and efficiently towards UH Mānoa by providing proactive academic advising, waiving the $70 application fee, providing the opportunity to take Mānoa classes, and giving you early registration when you start at Mānoa. Please let me know in the chat if you're interested in joining the program. It's free to join, and you just need to have at least 24 transferable credits, a 2.0 GPA, and at least 1 more semester remaining at the community college. So again, feel free to message me if you would like to know more about the program.
We'll go ahead and transition to Dr. Kiana Shiroma to talk about the Pre-Law, Pre-Health Advising Center. So Kiana, you can go ahead.
Awesome, thank you. Sorry, just give me a few seconds just to share my screen. All right, are you able to see that? Yeah, perfect. All right, so yes, thank you so much for having me. So again, I'm Kiana Shiroma. I'm the director of the PreHealth, Pre-Law Advising Center. And so I did want to clarify kind of right off the bat in terms of the fields on which we advise. So we focus on some of the main ones just because there are literally like thousands of different healthcare professions out there. But what we focus on are the main ones in terms of popularity or you know, those that are commonly applied to. So that would include this list here, as well as law as well. So we do advise on nursing too, but I just want to clarify that as well. So we definitely help those who are interested in applying for UH Mānoa's nursing program. However, we do prefer that you contact them directly, right? And that way that program can get to know you, you know, the sooner the better. But as Dr. Gonzalez had mentioned earlier, the nursing program, especially at UH Mānoa, is really, really competitive. And so to make sure that you have other options available, then you can definitely come in and see us. And we can talk about the other nursing programs that are available on island, which would include like Chaminade and HPU, for example. But regardless of what you decide to do, or even where you decide to go, right? Like you don't have to attend UH Mānoa to earn a bachelor's degree. But wherever you decide to go, you can still reach out to us and get any kind of pre-health or pre-law advising, because we're open to the public. So we help those who maybe have never even taken a credit within the UH system. So just know that we're always here for you, as well as any of your friends or family that may be interested in these fields. What we do exactly is provide advising, right? So that could be in individual advising appointments, and then we talk about your classes and experiences, as well as your specific application. So after you earn your bachelor's degree, then you would apply to your chosen professional school. So we would help you with your entire application, read through all of your essays, give you feedback, and then when you are invited for an interview, this would be more so for the health side. There's only a couple of schools in the nation who do law school interviews. It's mainly healthcare profession schools. And so those have interviews. And so we would do mock interviews with you as well. In addition to the advising, we have workshops, we advertise opportunities, and then we also have early acceptance programs, which I'll talk a lot more about later on. So I did want to mention that this is our website here, and part of it is because there's just so much information that is on here that I wouldn't be able to get through it in just one session. So for you to get much more information and maybe even to brush up on stuff that I do talk about during this presentation, you can just go to this website. And we made it so that, again, right, like if anyone and everyone was interested in pursuing a health or legal career, then they can go to our website and look at that info. So you don't even need to schedule an appointment with us to get that info. It's right there on the website for you. And so when you look a little bit closer at the tabs, there's one for health, right? And when you click on health, there's a drop-down menu from which you can choose the profession that you're interested in. And then for law, it would be that third tab from the left. And so I do want to prepare you that health and law schools are extremely competitive. So for example, for medical school, the acceptance rate is 40%. So that means that 6 out of 10 applicants for med school are not accepted, right? So that's a really scary stat. And I'm trying not to scare you, but I'm telling you this because, like how Dr. Gonzalez said earlier too, we want to make sure that you're as prepared as possible as soon as possible, right? And so what exactly does that mean? It means that for the pre-health and pre-law students, that we want to make sure that you have a quality application, right? That you have a very competitive application, because the field that you're applying to is very competitive. And so what does that mean then, right? Like what does quality over quantity mean? It means having a quality application for these 3 areas. And this is very generally speaking, but it would, your application would consist of these 3 areas here. So experiences, GPA, and then entrance exam for your chosen profession. And so I'll just go over these really briefly, because like I said earlier, we don't have a lot of time. And for our workshops, we actually have one workshop for each section. So we're condensing a lot of information in a short amount of time. So please bear with me. For the health side, regardless of what field you choose, we try to set up each field so it has the same kind of structure. So even if we're focusing on allopathic medicine, which is what most pre-meds are going to go into or look into, you can look at physician assistant, for example, and it would have the same kind of structure. So we're trying to make it as easy to navigate as possible. And as you can see, that first block there is explore, right? Because first off, we want to make sure that whatever field you choose is the right field for you. And I'm saying that because there's very many different reasons as to why you may go into a profession or maybe not go into a profession. So for example, I know there's quite a few nursing students or pre-nursing students in this presentation. And so I do want to make sure, as well as all of the other pre-meds as an example, that this is the right field for you. And so what that means is that there's different things I would want you to look into. And so first off, it would be trying to get that firsthand experience, right? Trying to get as much knowledge about the actual profession that you're going into as possible. And this is for a number of different reasons. So first and foremost, it would be for that actual like day-to-day kind of experience, like really having to possibly work with other people's bodily fluids, right? So blood, urine, feces, vomit, you're possibly going to be touching that with your own hands. And you have to see how you react to that. Although, you know, you may think, you know, theoretically you might be okay with it, to actually see it and touch it and smell it is something that's very, very unique. And so I say this, and it makes sense, but I say this because a lot of students come into our office and, you know, they want to be doctors, and that's great. So I say, what got you interested in being a doctor? And they say, my favorite show is Grey's Anatomy, which is great. That's my favorite show, actually. So I totally feel you. But that doesn't necessarily give you the actual real life experience, right? And then also, you know, in Grey's Anatomy, Dr. Grey owns a hospital that she practices in, which is actually very rare, right? That doesn't usually happen in real life. So again, you want to have actual real life experiences, and maybe, you know, maybe not all the doctors are as good looking as like Dr. Avery, for example, right? So again, having a realistic kind of perspective of what the field is. And when I say day to day, it means really looking at and feeling and experiencing these bodily fluids. I keep pushing that because my brother-in-law, he was pre-nursing, and he actually got into nursing school. This was on the continental US. And his first day, his first clinical in the hospital, he was really excited. His first day was in the ER. First patient, there was a construction worker who had a nail stuck in his hand, and blood was kind of like gushing everywhere. And my brother-in-law took one look at that and he fainted right there in the room. And a lot of you might be laughing now, but for him, it was kind of devastating, right? Like, he went through all of the prerequisite courses, the application, the entrance exam, and he only realized then that he fainted at the sight of blood. So even later on in life, when he had his first two sons, in the delivery room, he took one look and bam, he would pass out in the delivery room. So from his third to fifth children, he was not allowed in. He was just on the outside of the door, just waiting. And yes, it's funny, but realistically, right, like that's something we want you to know ahead of time. So don't be like my brother-in-law. So that's one reason why I want you to get that firsthand experience, right? Also, there are other reasons too. So for myself, I was actually pre-vet. I love working with animals. It's like one of my favorite things to do. But obviously, I didn't become a vet. And the reason being is that it wasn't the blood or the guts. I was actually fine with that. I love surgery. But for me, what I learned was that a big part of being a vet is putting people's pets to sleep, right? So putting people's family members to sleep on a daily basis. That was a big part of being a vet, or the kind of vet that I wanted to be. And for myself, I just couldn't separate the professional from the personal life, right? Because for me, it was so connected to, or they were so connected to each other. And so for me, I just could not separate that. And I was getting really sad and depressed. And so I had to stop that career path because I just knew that I wouldn't be able to handle that on a daily basis. And I wasn't even the one putting the pets to sleep, right? I was helping the vet with that, and already it was so emotionally draining for me. So there's that. And then just overall life balance, right? You want to make sure that, I know it seems very early, but you want to think about what kind of spouse you might want to be if you were to get married, or what kind of parent you might be or want to be if you were having children in the future. And yes, these seem like very grown-up decisions, or at least considerations to have. But I say this because a lot of times students, like in their junior, senior years, they come back to me and they say, actually, I maybe don't want to be a doctor because I realize that it's going to be taking a lot of time away from, you know, my future family or a possible family. So maybe they look into a profession that maybe not be as demanding on their time, right? So these are all things that I do want you to make sure that it's right for you now. And so that can come in a number of different ways. So this is our experience page. And so you can see that there's different ways that you can get this, right? So the shadowing, the volunteering, community service, the research. So these are the kinds of considerations you can make. Like ideally talking with a healthcare professional would be the best way to go, right? Shadowing, seeing that blood and guts, like I mentioned earlier. These are the kinds of experiences I want you to get. But then also the medical schools or the health professional schools want you to have this kind of experience too, right? They want to make sure that you know what you're getting into beforehand. And so making sure you have these are great. And, you know, referring back to the honors program, although you're not required to be an honor student in order to be pre-health, you can see, right, there's a lot of overlap with the experiences that you'll get from honors and, you know, what is required for schools anyway, like the research, for example. There's also a lot of internships and fellowships that are available through honors. So again, it's a really great overlap, but it's not something you have to do, but it will definitely help you and be beneficial for you in the long run. So then the next question that you're probably asking is like, well, Kiana, how do I get this, right? With COVID, we can't even, you know, go to the grocery store and feel safe. And so what that means is that doing what you're doing now, actually, which is great, is attending online events just like this, getting as much information as you can about your future career path, academic paths, and then also there are tons of online events that professional schools and professionals themselves are putting out there for people to watch. And so one way to look for these opportunities is to follow us on Facebook and Instagram. And so any kind of opportunity that we get nationwide, we would post on this website here. I'm sorry, on our social media here. So please feel free to follow us. You can do that now if you want, and you can already start getting, you know, more information and knowledge about these opportunities. As you can see, there's even like virtual shadowing, right, which is really cool. So although yes, it's not the in-person shadowing, at least it's something. And with all of these opportunities, I do want you to make sure that you record these, because even these online opportunities you can put into your application later on down the road. So you're showing that, yes, although you couldn't get in-person experiences, you're being really proactive and getting these online experiences instead then. And then later on, when you can, when it's safe, then you can, you know, do the in-person opportunities and the shadowing and whatnot. So moving on in terms of preparation, that would be kind of going back to, remember that application pie that I was showing you. So first was experiences, and then now we're moving on to GPA. And so when we talk about GPA, we're talking about a couple of different things. So first would be overall GPA, right? So regardless of whatever classes you take, whatever your major is, it doesn't matter. They look at your overall undergraduate GPA, or even, you know, what institution you attend. They take all of your classes and they put in a cumulative undergrad GPA, and that would be in your application. Another kind of GPA that they look at would be your prerequisite GPA, meaning like these courses that are listed, for example, for allopathic medical school, these would be considered prerequisite courses. And so they would look at the grades for these and then make their own GPAs too. So again, we really want to focus on the quality, right? So making sure that you're getting quality grades. And so that's why it's really important to work with your counselors and advisors, whether that be at LCC or UH Mānoa or UH West Oahu, wherever it is, right? You want to make sure that you create the best plan for yourself, because we want you to do the best as you possibly can in these classes. So it's not about quantity, right? Like how many credits you're taking a semester. It's about the quality, how well you do in these classes. So again, what to do now you're probably doing this already from what I see from the intros in the chat, is like choosing a major that interests you, right? Because ideally, if you like the classes that you're taking, that you do better in them, and then also enjoy them more, right? Because yes, we do still want you to enjoy your undergraduate career. Regardless of what you choose for your major, though, you still need to take the prerequisites, and they do differ by school. So you do kind of want to start looking into that already to make sure that you have the prerequisites by the time you apply. And like I said earlier, do well in your classes because GPA is really important for health and law schools. And then with those classes, especially those that will be tested in the entrance exam, you want to take lots of notes and then keep all of your textbooks. That was opposite of what I did when I was an undergraduate. Like at the end of the semester, I threw my notes away, I sold my textbooks, but don't do that, because you need to save those things for when you're preparing for the entrance exam. Because a lot of these exams, more so for the pre-health side, they're content-based, they're course-based, meaning that they will include biology, chemistry, physics. And so you're going to be referring back to your notes. So it's not just about the grades, it's also the content from those classes. So you're going to make sure that you keep all of these things so you can use them to prepare. So again, some other things I did, or I want to summarize with, is just making sure that your chosen career is the right field for you, looking at professional school requirements already, doing well in your classes, and then regardless of the entrance exam, please start studying early, because that is one of the biggest mistakes that my advisees make, is thinking that they can cram. And these entrance exams are not crammable, okay? They're just too much content to try to cram in. And so for my pre-meds, the entrance exam would be the MCAT. So we're looking at studying for around 3 to 6 months before, which is a really long time, right? So again, it's just really preparing early. And then also you want to apply early, because a lot of schools do have rolling admissions. So that means first come, first serve. They're going to have the most seats available at the beginning, right? So if you apply by their deadline, they're not going to have as many seats available. So again, the earlier the better, excuse me. So again, just kind of like repeating over and over what Dr. Gonzalez said, like the earlier that you plan, the better. And so I did want to share too, again, for my pre-health students, is that we also have early acceptance programs. And so this would be for incoming college students, current or transfer students, even current students if you're already at UH Mānoa. And so what these programs are is basically kind of like implied, meaning that you would be, this slide would be an example. So you would be early accepted into dental school or into medical school, or in, right? So you get the point. And so that means that you would apply, this is a separate application from UH Mānoa. So you would apply to these early acceptance programs. And if you're accepted in them, then as long as you fulfill their requirements like GPA and entrance exam minimum qualifications, then you're guaranteed a seat after you graduate. Right, so thinking back to that slide that I mentioned earlier about 6 out of 10 applicants for medical school not being accepted, so you wouldn't have to worry about that stat, right? You would already have a seat saved for you. And the reason why I entered these particular programs is because of the benefits that students get, right? So you would be able to plan past your undergraduate career. You would be able to even financially, right? Think about what kinds of needs would you have to enable to attend Lake Erie College of Osteopathic Medicine, right? And then also the stress level would be a lot lower because you wouldn't have to worry about if you're accepted or not. And then let's say worst case scenario, you decide you don't want to be a dentist, or maybe not even go into a healthcare profession, then that's totally fine. You can withdraw from the program. There would be no kinds of consequences, no financial requirements that you have to pay off, nothing, right? So it's very safe for the students to apply to. It's just having a seat at the end of your undergrad career if you still want to go into that school, right? So it's these are great programs. I helped West Oahu kind of start off with theirs. So they also have early acceptance programs that are coming up as well. So even if you don't attend UH Mānoa, then you can look into West Oahu's too, as well as a lot of other universities and colleges. They have these early acceptance programs as well. So even for these, the earlier the better, because we only have so many seats available for each program. And again, it's first come, first serve. So even if you're not sure, I would still recommend just applying, because you can always withdraw later on. So we covered a lot in a very short amount of time. But if you do have specific questions, or if you want to talk about your academic and application plans, then we do strongly encourage you to schedule an individual advising appointment with us. So we do meet completely online for this semester as well as next semester. But whatever you choose, you can just click on the academic advising button, and then you can just schedule an appointment directly with us through Star Balance. So again, we are PAC, and if you have any other questions or concerns, you can put them in the Q&A or the chat, and we can answer them now, or if not, then later on you can schedule an appointment with us. So thank you so much for sticking around, and yeah, please feel free to bring those questions in. I see them coming in, so thank you.
Awesome. So we'll go ahead and jump to this one question. It has multiple parts, so I'm just going to ask one at a time so we make sure we address each part. So first off, can PAC help people on outer islands find research opportunities?
Yes. So like I said earlier, we have opportunities that are posted on our Facebook and Instagram. And then also, if you go to our website, when you click on the subscribe link, we send out a monthly newsletter, and it has any kinds of opportunities that we get nationwide. And so right now, I mean, what's great, although I wouldn't want COVID for anyone, what's great though is that there's so many online opportunities that are available. So a lot of these that are open now, they're open to anyone regardless of where they are. So there's a lot of organizations, for example, on the mainland, who wouldn't usually be available because you'd have to go, fly to that institution to partake in that research opportunity. Now you can just participate online. So the opportunities actually are increased for our outer island advisees. So yes, for sure.
Very cool. Okay, so then can you make some suggestions for first and second year pre-med students about studying for the MCAT, besides start early?
So I'm going to refer to what I said a little bit earlier. So at this point, it would just be like trying to do your best in these classes, right? Because it's not just about the grades, but it's also like containing the content, right? So keeping that content in your brain. And so really trying to learn the material as opposed to just trying to pass that next test that's coming up, really trying to learn that material, because you're going to have to call back on that within a year or two. But then, obviously, realistically, how much are you going to retain a year or two from now? Like, I can't even tell you what I ate for breakfast like 2 days ago. And so, being realistic, you want to keep, like I said earlier, right, all of the notes that you're taking, all of the textbooks, even, again, another benefit of being online is that the professors are posting their slides or recording their presentations and sharing that, right? So I do recommend too, even saving all of that as well. So if maybe you didn't take really good notes, or maybe you were unclear about something now, then you can refer back to it, or those professors' materials later on to really clarify.
Great. And then last part of this question, is there a place to sign up for pre-med advising news to find out about workshops and such?
Yep. So like I said earlier, it's our social media, and then also our subscribe link. And I'll put that in the chat. Yeah, so you can sign up right now.
That'd be awesome. Thank you.
Yeah.
All right, folks.
Can I have a question? For community college students, they can do either liberal arts or natural science as their associate's degree before going on to Manoa. Which one do you recommend as a way to prepare for a pre-health future?
So Like I said earlier, it doesn't matter what your major or degree is in, right? The schools don't care as long as you take the prerequisite courses. So that would be my blanket statement. But realistically, it would be my community college advisees usually go into the natural sciences, right? Because there's so much overlap in terms of the prereqs and what you need to take for your associate's degree anyway. So it'd probably be natural sciences if I was really being honest.
Can you also talk a little bit more about major exploration? Like a lot of my students are shocked that they don't need to get a biology degree to go into med school. So could you talk a little bit more about that piece and how it's so important to choose a major that fits you?
Yeah, so it can be a little bit daunting, right? Because we have over 90 majors at UH Mānoa, so the possibilities are endless. And so they might want to think about even the courses that they're taking now, which ones, you know, are really interesting to them now, and see if there's a major for that at UH Mānoa or related classes that way. Also, what's great too is that some of my students decide on their major based on their experiences that they, you know, partake in as pre-health students. So, for example, the community service that they participate in, they realize that they have a really huge passion for public health. And so a lot of them then change their major to public health. And I mean, especially nowadays with COVID, there's just so much interest in public health. So Michelle, the pre-health advisor there, she says that business is booming, right? They have a lot of interest, a lot of you know, students who are interested in the major, and it's partly because they see how important, you know, this field is, right? So it could be a variety of different ways that you can choose what interests you. For myself, what I did too, because I didn't know exactly what I wanted to major in when I was an undergrad, is I just looked through, and this might be a little bit more time intensive, but you can just scan all of the different majors too, right? And start with a long list and then cut it down to a short list. That's another option. And then one last one too is that we have a Manoa Advising Center, right? And they help with major exploration as well. So you can always contact them, and they can help you in terms of, you know, finding what the best major would be for you. And then one other thing I would add too is that if you are interested in a particular major, then like how Dr. Gonzalez mentioned earlier too, meet with them, right? Like meet with the undergraduate chair, the department chair, and find out what that major is about and see if it's like the right fit for you. I think that those would be the best way to go, just kind of research, you know, see what's out there.
Can I jump in?
Of course.
I think there's also one of the things that I think undergrads who come to Manoa come to discover as they sort of take classes is that, you know, the medical field is really vast and varied, right? It's not just nurses, physicians, assistants, and doctors that are the jobs that are there for you. And so what you might come to discover over your time as an undergrad is that there are a lot of different slots to fill in this thing that we call the medical field, right? Research slots, epidemiology. I mean, there's just lots of different kinds of jobs out there. And I think it's important not to only just think, I'm pre-med, I'm going to be a doctor, right? And so a lot of our students in honors, and I think also Kiana's students, discover that there is a huge range of different possibilities that actually exist in the real world, right? That students who follow their passions can discover. And I think that if you just, when you're deciding on a major, it is true that the students who are science majors have a tendency, but I also see students being super successful who are in the humanities and who major in the humanities and then apply to grad school having done really well on their prereqs, right? Because those are the classes that the med schools look at. And when they're interviewing you, your ability to communicate, your ability to show that you know more about the world than maybe what exists in a lab, the ability to relate to other people will be important if you are planning to go into the medical field, because so much of that is people skills, right? And just in conversation with the admissions folks at JABSOM at one point, they said, please do send us students outside of the natural sciences as well, because that's really interesting. It makes for interesting conversations. It makes for interesting perspectives. People with different kinds of training bring different things to a collaboration and the problem solving process, right? When you have a different way of thinking. And so I think that's really important, and it's going to be super important going forward. I mean, you can see this happening with the pandemic and the way people are trying to problem solve a very complex issue. You're not just going to have medical doctors addressing this problem. You're going to have economists. You're going to have, you know, so that you're going to see all kinds of different expertise being pulled into an issue that's conceived of as a medical issue. So follow your passion, because you will be able to speak to that, and it'll come from a place of great, you know, knowledge and a great investment in a particular direction. When you do your interview for med school, or where you write about something, you'll stand out. So that's the other thing. So just to kind of play a little bit of devil's advocate regarding what Kiana had said, because I don't think that they're at odds with each other. I think that there's multiple pathways to getting to med school or the medical field.
Thank you.
Thank you.
Yeah, that was really good. Kind of tagging along what Bernadette was talking about, Kiana, do you have like a pocket of, I guess, professionals that students could talk to? You know, sometimes all they know is their doctor or their, you know, uncle is a doctor, but do you have someone who could speak, I guess, deeper truths beyond academics, as far as what else is out there in the health profession, and, you know, the pros and cons and what's coming? Would you have that? I know you have virtual shadowing, but kind of a list of people students could talk to.
So yes, we do. However, Lori, to be honest, usually the best way for students to talk with healthcare professionals would be actually their own personal professionals, right? So professionals for whom they're patients of. So usually that personal contact is usually the best way to go, because it's already there, right? That connection is already there. So that could be helpful. And then also, you know, asking your friends and family, you know, who are your best physicians, or who's your best dentist that you've seen, and then contacting that professional and saying like, hey, you know, my mom's your patient. She says that you're the best physician out there. I want to be a physician. You know, can I meet with you to learn more about your career, right? So things like that, that personal connection is usually the best way to go. Even those that maybe you're not a patient of, but you live near, a lot of times those kinds of professionals who are working in that same community as you are also really supportive and helpful too, right? Because they want to help future professionals in that area that they're living and working in. And so that's another great way to go, is just kind of going a little bit old school and just kind of Googling and seeing what's around you in terms of, you know, those kinds of professionals, and just contacting them that way. Again, right, it's kind of that a little bit more indirect, but it's still that kind of personal connection that one may have with a professional. And then yes, we do have those professionals who are open to seeing anyone and everyone. So we don't have a ton of you know, specific individuals, because they are really busy too, right? And that's a huge commitment to ask them to post their contact information on the website for anyone to contact them. But for those that we do, that's on our website as well. So kind of thinking back to that slide where we listed the different kinds of experiences, when you click on shadowing, then it will have a list of individuals who are open to anyone contacting them.
We actually also have somebody in common. Dr. Sharma's office and honors both work with Maria Chun, who is a PhD in psychology, but she works at JABSOM surgery department. But she also likes to come over and teach in honors. And I know that she's worked with some of the PreHealth students just in terms of looking at materials and that kind of thing. So there are folks who are willing to help out students and to, you know, set them on the right path or to suggest alternatives as well. So
Thank you.
We do have one more Q&A that I can ask. So for a student planning to pursue dental hygiene for now, is it okay if students can graduate from the dental hygiene program before taking the DAT for dental school?
So it's really interesting because realistically, you would think that, you know, earning a bachelor's degree in dental hygiene would be able to prepare you to apply to dental school. But unfortunately, in most cases, that is not the case. And the reason being is that dental hygiene school is just really intensive in terms of its prereq courses and then also the curriculum itself. So usually the curriculum is just full-time. There's not really any kind of wiggle room in terms of adding on the dental school prerequisites, which unfortunately don't overlap that much with our dental hygiene program. So in most cases, my pre-dental applicants, they actually major in something that is more traditional, like biology or chemistry, because then they have a little bit more like wiggle room in terms of being able to take the prerequisites. And then also the prereqs tend to overlap much more nicely with these kinds of majors as opposed to the dental hygiene major. And then kind of looking further down the road, whoever asked that was asked really great questions, because looking further down the road in terms of the DAT, that's another huge roadblock that my dental hygiene advisees run into. It's because they're not able to be able to really take time to study for the DAT, because it's so, the dental hygiene curriculum is so intensive, right? You're doing a lot of clinicals and like hands-on work that a lot of my pre-dental applicants just don't have time to study for the DAT. So another option though would be to finish your bachelor's degree and then complete whatever prerequisites you have left and then apply to dental school. But the only issue with that is that it's adding on years, right, in terms of being able to apply to dental school. So yeah, sorry, generally speaking, it would be more so looking at those traditional majors like biology and chemistry, but you're still able to possibly get that kind of hands-on experience by being a dental assistant outside of classes. So great question. And yeah, that would be so understandable in terms of thinking that, but unfortunately the curriculum is really intense. Just like how a lot of people think getting a bachelor's degree in nursing would help them prepare to be or prepare to apply to medical school. Unfortunately, that's not the case because the curriculum is just so intense for these particular professional majors.
What about with EMT? Like I have a student, she wants to, she's gonna finish her natural science associates, then get her EMT associates, then come back for biology as a bachelor's degree. What are your thoughts on that route, and like, you know, what recommendations might you have for a student who wants to become a doctor in the future?
So that's great. So EMT, phlebotomy, those kinds of programs are a little bit different, right? Because they're much shorter, right? They're not longer associate's degree or bachelor's degrees. They're usually, like EMT is usually, correct me if I'm wrong, but I'm pretty sure it's like around 3 months. And so or 6 months, depending, but basically the time commitment is a lot shorter. And then depending on, you know, these kinds of programs, a lot of times they work around full-time employees. So the classes may be more so like in the evenings or the weekends. So they might be a lot easier to fit in. So those would be great. And the reason being is that you get that hands-on kind of experience, right, that I mentioned earlier. And so, once you complete these courses and then you're able to, get these kinds of experiences, it's amazing. Realistically though, not too many of my students go into EMT just because it's one of the longer training programs. A lot of mine go into CNA, so certified nurse aide, or phlebotomy just because the programs are shorter. And there's also like CNA in terms of positions and opportunities, there's just so many out there. So graduates can like really get their pick in terms of what they want to do. So usually, yeah, students go into more CNA, but generally speaking, that kind of experience would be really helpful, right? Because you're getting that hands-on training and kinds of opportunities that I mentioned earlier. So those are great, but again, I recommend planning earlier, because if you're trying to do EMT training while studying for the MCAT, then I don't think that would be as reasonable as if you started earlier on.
Thank you. Okay, I will tell my students the good news that it is totally possible to do that and recommend it.
For sure.
Yeah. Are there any other questions for either Dr. Shiroma or Dr. Gonzalez? Do you see any in the Q&A? I can't open up the Q&A. I'm like, okay, no. All right, perfect. So I'll go ahead and close us out. Thank you again to Dr. Shiroma and Dr. Gonzalez for joining us today for our last Transfer Tuesday. And thank you so much to all of you for joining in as well. We are going to keep running this series throughout the spring semester, so be sure to keep an eye on your email for our next slate of offerings. If you have any questions, please feel free to add them to the chat. Jordan and I will probably stay on for a couple more minutes if anybody wants to talk. All right, stay safe, everyone.
Thanks for having us.
And then